Hello, my name is Christina Seal, and my research proposal was looking at healthcare workers dealing with the pandemic and the effect it's having on their mental health. Healthcare workers in the ICU of hospitals are highly capable and skilled professionals. They have been trained to manage and monitor critically injured or ill patients with their ability to think and work quickly in stressful situations and stay alert for extended periods of time. We expect them to perform the role of advocate for their patients, supporting and respecting the basic rights and values and beliefs of a patient who is critically ill or injured. As a society, we've come to take for granted that if we or our loved ones become seriously injured or critically ill, the ICU of the hospital is where they will do everything possible to make sure that we have the best chance to recover. The global outbreak of COVID is taking a toll on the healthcare workers' mental health, especially those that are working with the critically ill patients that are in the ICUs, the very sickest ones that are dying. ICU healthcare workers typically care for one or two injured or critically ill patients at a time. In the face of this global pandemic, the circumstances of their work has been ramped up to impossible heights. Trained ICU healthcare workers are faced with the constant reality of dying patients every day, when previously it was the exception, not the norm. The research question for this study was, what are the long-term mental health effects of frontline ICU healthcare workers? The hypothesis is that the long-term results will be similar to those experienced by the long-term frontline military confrontations. Existing research that was focused on the SARS outbreak showed that healthcare workers developed significant mental health problems as a result of that epidemic. The scope of this global pandemic is much bigger than the SARS outbreak was. So it stands to reason that the adverse effects will be even more serious. Considering the vital ongoing role of the frontline healthcare workers, this is a very important issue. This research could play an important role in laying a foundation for addressing this problem. In one study, the fact that usually at least some of the patients in these ICUs are getting better, and right now a lot of these patients in the ICUs are dying, in fact most of them. So there's a concern by some mental health professionals that the immense stress and grief that nurses, physicians, and other frontline medical workers are experiencing will lead to a wave of mental health issues among the people in the field. A pandemic of mental health issues and crises, including medical professionals leaving the industry and higher risk for suicide and post-traumatic stress disorder. Also, in a study by Moeller, the healthcare workers dealing with the pandemic also reported more anxiety, depression, sleep problems compared to the general population. Keeping the ones that take care of us well is vitally important, yet findings of psychological distress among healthcare workers might indicate that the care system is currently unable to effectively help the helpers. We propose using a non-experimental design in which relationships are assessed without manipulating the independent variable or randomly assigning participants to different conditions. We propose using a quantitative methodology and a control group to examine possible relationship between current pandemic and adverse mental health outcomes in those immersed in the ICU treatment of such. Using stratified sampling because we need to look at the subgroup. We will be looking at healthcare workers, but healthcare workers that deal solely with COVID-19, and then healthcare workers that deal solely with COVID ICU patients. We will recruit on social media platforms such as Facebook. We will also be using an incentive to participate, and that's they will know what their results are. We will also be using surveys that will identify the correct population. Also, flyers of hospitals with high COVID numbers. We will get our questions from existing questionnaires that evaluate depression, anxiety, and PTSD. We will take information from those existing tools like the PHQ-9, the Depression Anxiety Stress Scale, and the Davidson Trauma Scale, and make our own survey building from these. Our goal is to get 500 participants because the margin of error associated with that sample size is generally accepted to be plus or minus 4%. The criteria for inclusion are that they must work only with COVID patients that are in the intensive care unit. There will be a comparison group that do not work with COVID patients. Ethically, medical meta-analysis studies have been done that show that there is very little harm, even those with PTSD, in this kind of survey. Informed consent will be essential, so they will know what they're participating in and that it is confidential. Participants will complete the survey and it will be confidential but not anonymous. Strengths of it are that it provides us with a sample that is highly representative of the population being studied. Random sampling also allows us to make statistical conclusions from the data collected. Disadvantages is it can only be done if a complete list of the population is available. To avoid bias, we need a certain amount of participation in the research, so contacting respondents could be time consuming. The dependent variable is the long-term effects of dealing with the pandemic as measured by the PHQ-9 patient health questionnaire. Anyway, the independent variable will be the healthcare workers in the ICU only, and a comparison group will be made up of the healthcare workers not working the ICU. While we don't deal with a pandemic very often, we do all have moments when we need healthcare, and the healthcare workers need to be taken care of. Our target population is the frontline healthcare workers. When it is determined that the mental health of these critical ones is impacted greatly, we need to make sure that they have access to the mental health services that are greatly needed. Our job as social workers is to help those needing help, and these workers are helping all of us to survive the pandemic. While doing this, they are putting their own physical and mental health in jeopardy. So, thank you.